Hey everyone, so I'm Melissa. I work at Commonwealth. We are a national mission-driven organization, and we work to build solutions to make people who are financially vulnerable, financially secure, and put them on the path to financial opportunity and economic mobility. So we make wealth more common, thus common wealth. So this morning on the drive in, I decided to change up my entire presentation, so we'll see how this goes. We are user-centered, so we do a lot of our work based on our conversations with people who are financially vulnerable. And around 3 years ago, we started hearing over and over again about the impact of health care on people we were talking to. We were talking to them about banking. We do a lot of work in the financial services industry. And we kept hearing over and over again about their healthcare issues. So we decided to do a little bit of research and find out more about what was going on. So I'm just going to distill this down to 3 facts that have stuck with me, and I think Amy talked about them already at the beginning. One was deductibles keep going up, right? How many people 10 years ago had a deductible? How many people today have a deductible, right? We all have lived this. The second fact, which Amy also talked about, is most of us don't have $400 in savings. Most of us have no cushion. I think many of us saw this with the government shutdown recently, about how many people were living paycheck to paycheck. And therefore, not surprisingly, lots of people are not going to get the care that they need because they can't afford it, right? Seems kind of logical after the first 2 facts. The third one seems obvious. And so 3 years ago, I came to this conference, and I met Amy, and we got talking, and we decided we wanted to work together and engaging with each of our communities about how to have an innovative approach to designing better health insurance plans. And so what we did was we did a bunch of research. We talked to lots of people. We had a participatory design workshop, and we launched last summer, actually at this conference last year, a design and innovation challenge. And we said, how can we design the open enrollment process? Because that became clear to us as a huge pain point, right? To allow people to neither have medical hardship or financial hardship, right? We didn't want people to have to choose between going to the doctor or having medical debt. And so how could we engage all of our communities, the design community, the healthcare community, the financial services community, to help us come up with new ideas? So we launched this last summer. We got some amazing responses. We got a group of MBA students from Berkeley. We got an employer in Florida. We got a design firm and a consulting firm here in Boston. And based on all of that, we gave out prizes back last October at the Financial Experiences Design Conference. And the little brochure you have talks about very specifically all of the details. But I decided instead of going into details, I'm just going to talk about 4 things that have stuck with me that I think are critically important and have huge potential, because I've seen them in the marketplace. I'm starting to see, as I go out and talk to people, that people are already doing some of what I'm going to talk about, which makes me think they're businessly viable, so that there's a real way to bring these innovations to scale. And secondly, I think that they will have the most potential impact for people who are financially vulnerable. And that's who I think needs the most help in this situation. So I'm just going to talk about 4. So first, at the moment of open enrollment, we could do a whole lot better at leveraging data and resources. And what I mean by that is when we talked to people and said, what would you need to make a healthcare budget? They said, I would need to know what people like me spend on healthcare. I need to know what a 50-year-old woman in Boston is likely to spend on healthcare. That would help me make decisions. Because right now what we're telling people is save for the deductible, right? How many people can, my deductible is $6,000 a year, right? That is not affordable. And so right now I'm being told, save for the deductible. I don't save anything, right? If that just seems out of the realm. So we need to leverage personalized data to help people understand at least a reasonable amount that they can save. We also need to leverage other resources. Many, many employers have financial coaching through their employee assistance program. At open enrollment, have that financial coach from the employee assistance program available and trained, and link those 2 things together. There's an employer in Florida who's already doing this, Health First. The second most important thing is open enrollment. How many people look forward to open enrollment every year, right? How many people dread open enrollment, right? And so we think there's a real opportunity to make it easier. And the big way of doing that is through auto enrollment and contributions. So if you think about retirement, how many people have an automatic retirement, right? Imagine if you had that for your health savings account. Much easier, much simpler. And we are actually big proponents of making it fun. Could you imagine open enrollment as a fun thing to do? Right? Probably not. But think about Fitbits, right? That has transformed exercise and has made it much more fun. And we think there's huge potential to gamify through incentives and through gamification to make open enrollment fun. Imagine if you looked forward to open enrollment. You know, we were talking about moonshots earlier. That's my moonshot. Everyone's like, woohoo, can't wait till open enrollment. So that's my second insight. And I've seen that happen. I'm seeing more and more gamification at open enrollment and much easier processes to open enrollment. Third, payroll tech. The payroll technologies have been transformed recently. I remember when I started in HR many years ago, everyone had to fill everything out in triplicate. Remember those forms that had like carbonless forms, right? And you had to press really hard to make sure that it went through. Those forms should be a thing of the past. You'd be surprised they're not. Payroll tech now allows for people to make changes whenever they need to. Financially vulnerable people have incredibly volatile financial lives, right? They don't know often what their income is going to be each month or what their expenses are going to be. So they need the ability to change how much they're putting away for savings, for example. Right now, the expectation is open enrollment, you decide $100 a month into your HSA or FSA. That's not realistic for financially vulnerable people. They need the ability to change on demand, and payroll tech allows that to happen. But payroll technology has not gotten to the health insurance field yet, and we need to bridge that gap. And finally, changes in payment technology, right? How do people usually pay for stuff they buy at Amazon, right? Do they need a separate special Amazon credit card? I mean, Amazon would like you to have one, but you don't need a special credit card for Amazon. Most health savings account, you need a separate credit card. You need to remember to put it in your wallet. You need your husband to remember to ask you for it so he can put it in his wallet. Your 15-year-old daughter needs to remember to bring it when she goes to the doctors. And if any of you have 15-year-old daughters, you know what I'm talking about. But there's all sorts of new payment technologies. There's virtual cards. How many people pay with their phone? Anyone pay with their phone? You can't pay for healthcare expenses with your phone right now. Why not? Right? So if we can bring the payment technology innovation to health insurance and to how you pay for health expenses, that would be huge in terms of allowing people to do better. So we're all about action. We, MadPow and Center for Health Experience Design and Commonwealth collaborated because we wanted to see change. We want action to be taken, right? We're not just interested in new ideas. We want other people to take up these new ideas, and we think there's huge opportunities for everyone in this room to do something, for Humana to think about how they sell their high-deductible health insurance product, and how do they bundle it with a health savings account product. For employers, all sorts of amazing things you can do to help support the health and both the financial and physical health of your employees. If you're a health savings administrator, I want to talk to you because there's all sorts of stuff that I can do to improve your business. And if you're a benefits broker, bring new ideas to your employees. They'll thank you for it. So my goal for today is for everyone in this room to think about what you can do in your role to make high deductible health plans work for a win-win in a way that doesn't mean that people have to decide between going to the doctor and going into debt. So I want to thank Amy for working with us on this project. It has been an amazing collaboration.